So hello students and welcome back to the clinical case discussion of the thorax. We are here with case number 6 for you. Have a look. A patient with pleuritic pain complains that the pain is felt at the tip of the shoulder. Means pain of pleura is felt at the tip of the shoulder. Worse with inspiration. Okay, so pleuritic pain, the person complains that pain is felt at the tip of the shoulder, worsens with inspiration. Imaging suggests pleurisy, okay, involving the central diaphragmatic pleura. So the diaphragmatic pleura is irritated. So there's pleurisy, and the diaphragmatic pleura is irritated. The person gets a referred pain at the tip of the shoulder. Can you tell me why? So this, you're clear with the question? So person has got pleurisy, the person gets a shoulder tip pain. On imaging, we see that the diaphragmatic pleura is involved. Now, can anyone tell me what is the nerve supply of pleura before we go to this clinical question, before we approach this clinical question? So tell me students, pleura is of two types, right? Parietal and visceral. Parietal and visceral. Visceral pleura is supplied by autonomic nerves, sympathetic and parasympathetic. It is supplied by autonomic nerves, sympathetic and parasympathetic. It is pain insensitive. Okay, pain insensitive. It is not sensitive to pain. Compare this to parietal pleura. Now, parietal pleura is of different types. One is costal pleura, one is cervical pleura, cervical pleura, diaphragmatic pleura, and the other one is, what is left? Mediastinal pleura. Mediastinal, mediastinal pleura. So parietal pleura is made up of four types: costal, cervical, diaphragmatic, and mediastinal. Now, can you tell me the nerve supply of this? Like, this is the concept. If this concept is clear, yes, you will be able to answer this clinical question. So costal and cervical pleura are supplied by intercostal nerves, and diaphragmatic and mediastinal pleura are supplied by phrenic nerve. Okay, so costal and cervical, intercostal nerves, and these two are supplied by phrenic nerve. Now tell me, so there is a irritation of the diaphragmatic pleura. There's an irritation of the diaphragmatic pleura. Who supplies the diaphragmatic pleura? The phrenic nerve. The phrenic nerve, yes. So the pain is referred to the tip of the shoulder because the root value is the same. The same dermatomes. Okay, so the root value is the same. So the phrenic nerve pain, the pain from the diaphragmatic pleura is referred to the shoulder because of the same root value. This is what we call as the referred pain. Clear? So clear? So this is clear. Have a look at this now. Again, see the question. The patient with pleuritic pain complains that the pain is felt at the tip of the shoulder. You understanding? Worse with inspiration. Image suggests that pleurisy involving the central diaphragmatic pleura. So diaphragmatic pleura supplied by phrenic nerve, the same root value, the nerve supplying the tip of the shoulder. Okay, so that is why the pain is referred to the tip of the shoulder. So which nerve mediates this pain? That's a phrenic nerve. What is the spinal root value and why does it refer to the shoulder? So what is the root value of phrenic nerve? C3, C4 and C5. C3, C4, C5, and the nerve supplying the tip of the shoulder has got the same root value, and that is why this is referred to the shoulder. Same root value, C3, C4, C5. Okay, these are the supraclavicular nerves, right? Now, in contrast, costal pleura pain travels through which nerve? I just told you, students, the costal pleura and the cervical pleura. That is supplied by whom? That is supplied by the intercostal nerves. So this is supplied by intercostal nerves, whereas the diaphragmatic pleura and the mediastinal pleura are supplied by phrenic nerve, right? See the last, what is the key exam phrase differentiating visceral and parietal pleural pain? So what is the key phase? I just told you. The parietal pleura is supplied by somatic nerves. Somatic nerves, so it is pain sensitive. It is sensitive to pain. Okay, I'm not written this. It is pain sensitive. So this will be pain sensitive. Okay, pain sensitive. Whereas visceral pleura is supplied by autonomic nerves, so that is pain insensitive. This is pain insensitive. You understand the last question is clear? The last question is clear in contrast to key exam phase. Is this clear? So this question is mainly based on pleura. You have to know the types of pleura. You have to know the nerve supply of the pleura, right? And which pleura is supplied by which nerves, basically. And why does the diaphragmatic pain refer to the shoulder? Because of similar root value. So that's the MCQ. Fine, that's a clinical case, sorry. And now we come to an MCQ. Students, if you have understood this clinical question, you should be definitely able to answer this MCQ. Pain from the diaphragmatic pleura is carried mainly by which nerves? Answer in the comment box. Students, finding it easy, finding it interesting, finding it easy to approach a clinical question. So make it a point to see the entire series. Okay, upper limb is done, lower limb is done, clinical case discussion. Now we are there in thorax. Make it a point to see the entire series, gain confidence, have confidence on the basic sciences. Thank you so much. Thank you to all of you.